Weight management services provide help and hope for obese people. At Heartlands Hospital in Birmingham, there's a new state-of-the-art unit providing tailored care for obese patients. Exercise regimes, dietary advice and complex surgery are all part of the mix that will provide a cost-effective service for obese patients.
This new £10 million weight management clinic and research centre deals with patients referred from all across the region. It's a state-of-the-art facility. Even the chairs have been specially designed for the larger person. And it houses a multidisciplinary team of physicians, dieticians, psychologists and surgeons working with people with significant weight management issues.
I've got some children and they said, "Dad, you really do need to lose some weight now. We don't want you to die younger," and obviously it is associated with increased pressure on the heart, isn't it? High blood pressure. It'd be nice to, go and play football with the children, which I think if I run around the football field at the moment, I'd have to sit down for 2 hours.
Strangers can come up to you in the street and tell you what you should be eating and you shouldn't be eating, and call you names. It is difficult going out and people would look at you, and where you could go to a restaurant and enjoy a meal, you can't, because if you're a fat person, people are thinking, no wonder they're fat, look, they're actually eating.
What do you want me to do for you?
I want me to lose weight so that I lose the diabetes.
So we need to agree a plan together in the next few months to get you to where you want to go, which is for you to become more healthy in terms of what you're doing. Within the West Midlands, we have some of the highest levels of obesity in the UK. So a major problem in this area regarding obesity and all the problems that comes with it, such as diabetes, high blood pressure, cholesterol, and eventually strokes and heart attacks that accompany these. The traditional view is the consultants sit in hospitals and general practitioners sit in general practice, but there's a lot of sort of intertwining of the two that can happen within the community, and that's what we're trying to provide, really. And I think general practice and hospital care shouldn't be so separate.
To minimise separation between primary and secondary care, consultants hold clinics in community health centres such as this one in Birmingham's Highgate.
The barrier needs to be lifted between the patient and the doctors. So it's much easier if they are dealt with at a local, more convenient place for them.
Unravelling what's happening to them and helping them to move forward, I think works actually much better away from the hospital in a community setting. I tend to favour trying to make the healthy changes and achieve a modest weight reduction as a first step. Often people are looking for a lot more weight reduction that you can actually achieve by healthy changes, and that's where we sometimes refer them on to secondary care for surgery.
As a psychologist in the team, I try and help people look more closely at their behaviour and helping them to make connections between their emotions and their behaviour and their eating and how that impacts on their weight and their relationship to food. Other people are very resistant to those ideas and very much nothing's going to help me, I can't make any changes. And they're often the people I think that maybe want surgery and want a sort of a medical intervention.
Bariatric or weight loss surgery is a key part of the mix at Heartlands when all else has failed. A range of operations on the digestive system are carried out, the most common being fitting a gastric band to restrict the amount of food entering the stomach. It's done using laparoscopic surgery and takes about an hour.
Operations are not a fast fix. They should really be regarded as a last resort. There are many types of surgical operations available to help people lose weight. Perhaps the most simplest is the gastric band, and that's the most popular operation in the world today. Looking after an extremely obese patient can be very expensive. If you have a finite pot of money, it makes good sense to spend at least some of it on obesity surgery, because obesity surgery doesn't just make people look and feel better, but it treats impossible conditions, and at the end that saves us as taxpayers money. I treat perhaps 30 patients every week now. Within that, perhaps 3 or 4 diabetics will be cured every week, and I know of no other treatment that cures diabetes.